learners, welcome to the yet another session of environmental and occupational hazards. Today we are going to discuss about hazards that are faced by the health workers especially. So, the hazards, which hazards we have to taken care of? Today we are going to discuss about the physical hazards which are faced by the healthcare workers. We know that health services require a broad range of workers like doctors, nurses, technicians, laboratory workers and social workers, responders at various levels, and maintenance, security administration, food services, housekeeping and then mortuary. So, there are a big list of workers in the healthcare sector. So, healthcare professionals, whether it is a doctor, whether it is a mortuary personnel, whoever it is, all persons, those who are working in the healthcare settings and also who have the potential for the exposure to the patients and infectious materials like body substances and contaminated medical supplies, equipment and contaminated environmental surfaces and contaminated air. And also the health services are they will provide at variety of settings. They may be a small, sometimes it may be a large or outpatient, inpatient, birthing places, operation theatres, emergency care, sometimes clinics, nursing homes and also household also. So, healthcare is the fastest growing sector across the global economy, which employs over 18 millions of workers. And also women represent especially 80% of the healthcare workforce. So, healthcare workers definitely face a wide range of hazards on the job like sharp injuries and harmful exposure to the chemicals and hazardous drugs and back injuries and latex allergies, especially in they are wearing the gloves, and also violences from the patient side and lot of stress. Even though it is possible to prevent or reduce healthcare worker exposure to these hazards, healthcare workers they will continue to experience injuries and illness in the workplace. So, some cases of the non-fatal occupational injuries and illness with the healthcare workers are the highest of any industrial sector. If we will try to ensure health of patients and public, these healthcare personnel they will face a wide range of hazards to their own health because of the injuries like needle prick and musculoskeletal disorders and allergens and also infections like virus infection, bacterial infection, sometimes it may be a parasitic infection, violence, and the list is very big. So, they have the potential to get exposed to infectious materials like body substances sometimes and blood stains and air and anesthetic gases and radiation equipments. So, first we have to look into the physical hazards faced by the healthcare workers. So, the Center for Disease Control and Prevention has reported more than 40% of the needle stick injuries are suffered by the nursing professionals and also in developed countries. So, the circumstances in which most nursing staff occur involve the manipulating a needle, that is a 26%, and also the sharp disposal, that is a 21%, and collision with the workers are the or otherwise we can say that it is a sharp, that is a 10%, and cleanup materials, that is a 9%, and also the recapping needles, that is a 5%, or sometimes it is a surgery. So, computer workstations and handheld devices, laboratories and minimally invasive surgeries and patient handling, slips, trips and also falls because of the wet floor of the staircases, ramps or the cables or cords, lighting and also sometimes the spills. So, they may lead to the various injuries. So, if you will see the musculoskeletal disorders, they are the major common as well as concern in an occupational health care. So, the injuries that occur frequently and are more often because of the repeated handling of the patients and also involves a heavy manual lifting when transferring or the repositioning of the patients from one place to the another one and also working in extremely awkward positions. and the lifting becomes more difficult by the increasing weight of the patients to be lifted due to the obesity, sometimes epidemic in many of the countries, and also increasing number of the elderly people, those who require assistance with the daily living activities. So, potential physical exposures in the hospitals mainly have the excessive noise in sterilization centers and operating rooms, food services areas and engineering units, temperature extremes in kitchen facilities, boiler rooms, laundries, and also ionizing and non-ionizing radiations like laser and radio frequency. For example, in the use of the laser therapies, that is in the treatment, laser radiation absorption that will be resulted in the thermal damages when the laser radiation raises the temperature of the body tissue. So, obviously that can be resulted in eye injury and also skin burns and also electric shock. So, medical evaluation that mainly focuses on the visual acuity and also the fundoscopic examination, which are recommended in pre-employment and also after accident and the end of the employment. And radiation exposure that can occur normally the diagnostic imaging procedures and oncology treatment area and patients those who are treated with the radioactive isotopic agents. So, bodily protection with appropriate aprons or otherwise personal protective equipment and that containing lead is very effective. And some ergonomic hazards are also there, they will face, like heavy lifting, repetitive and forceful movements and very difficult postures that arises from the improper work methods and improperly designed workstations and other equipment. Like task related risk factors for the musculoskeletal injuries are patient transference and from one place to the other one, and material handling and frequency of lifting and pushing, pulling of the objects and poorly designed work areas. So, these ergonomic hazards can lead to the musculoskeletal disorders that can affect the nerves, tendons, muscles and also supporting structures of our body, especially low back pain and also carpal tunnel syndrome are well recognized work related musculoskeletal disorders. And some other physical hazards like toxic, reactive and also corrosive, flammable, compressed gases and chemicals, high temperatures that definitely causes burns or heat stress. And mechanical hazards are also there, they will cause the lacerations, punctures or abrasions, and electrical hazards like radiation and sometimes noise, violence and also slips and falls. After the overexertion, falls on the same levels is the leading cause of the injury or the illness for the health services, which is followed by the contact with the objects. And also fire in the hospital is very disastrous in nature. Unavoidably, it is likely the properties are full of fire hazards. But when you take the right precautions, accidents can be avoided. So, first of all, make a note of potential sources of ignition, fuel and then oxygen. Electrical equipment, heaters and cooking equipment and naked flames are all possible causes of a fire. So, these risks can be reduced by simply ensuring all equipment which is maintained and serviced to the manufacturer's guidelines by the professionals. So, they also needed to be kept in a safe distance which are away from the things which can burn like cardboard, boxes and medical supplies, toiletries, aerosols or the cleansing products and waste. So, it is important to store and use them as directed. So, the main source of oxygen will come from the air which is surrounded by us, but we have to ensure that medical oxygen supplies are managed as per the guidelines. Next, we need to identify the people, those who are most at risk, that is the staff, those who are working and covering day and night shifts especially, and patients, residents and also visitors which are most likely to be affected. But do not forget about the temporary staff as well as the contractors. And also it is most important to consider individual needs, medical conditions, sensory awareness and mobility. So, we need to seek professional advice and discuss the needs with each individual. Some may be able to escape unaided but will take longer duration, and some other will needed assistance and maybe even specialist equipment. And some patients, those who are very vulnerable residents, we can say that staff will require evacuation training. I would like to quote one example. In December 2011, a fight broke out in the early hours in a private hospital which is present in the Kolkata, and then the fire began in the basement, and also because of this cigarette stub. The highly inflammable material was stored. So around 90 people and also mostly immobile patients died because of the suffocation as well as the injuries. So another fire also broke out in a hospital in Bhubaneswar in 2016, and also because this is a failure of hospital administrator to get a fire safety certificate from the relevant authorities. And another important feature is also there, that is a physical violence. Normally hospital violence like physical assaults, threatening or violent behavior, they are growing problem in the hospitals. Recently there has been an upsurge in the cases of the violence by the aggrieved family, friends and neighbors of the patients against the hospitals, against the nurses, doctors and also those who are associated with the hospitals. So normally patient care is an emotional and sensitive issue. So healthcare workers, particularly doctors, they are the whole and soul responsible, and also they are trained in the soft skills like counseling or the conveying the bad news to the patients, patients' relatives, and also because they will turn out to be prime reason for the public anger against the hospitals and their staff. So healthcare workers, which are those who are involved in caring patients of the psychiatric disorders, they are exposed to violence by the confused or mentally unstable patients. So the employees, those who are need to comprehend about the movable furnitures like chairs or the items on counter tops, and that can be used as a weapons, or they will entrap them sometimes. So technical factors are also there, that is a poor ergonomic design of the building, adverse working environment like hot, cold or draughts from air conditioning, and insufficient space for the working activities that may lead to the awkward postures and also unsafe displacement of the goods. Unsuitable ergonomic designs of the workplace is also there, and sometimes arrangement of height and arm reach, and organizational factors like they are very strenuous working hours, and the tasks are for example carried out too frequently or for too long a time of workers, and working hours are too long without breaks, and lack of training and also follow-up training methods, and non-provision of suitable personal protective equipment like footwear or working gloves, and also some of the that is a manual handling of loads which are carried out by one or more workers like lifting, holding, lowering, pushing, pulling, and carrying or the moving of loads. So manual handling of patients, that is also covers all activities where the weight or part of the patient weight is raised, pushed, pulled or transferred from one place to the other one. And some awkward postures like movements like bending and twisting, raised arms, bent wrist, overreaching and overexertion. So repetitive activities of this type of handling, they are found in health workers normally. So prolonged standing hours like operation theatres and also at the operating table, and it is quite often combined with the bent over or awkward positions. So precautions for this type of hazard category are wearing the right shoes and properly cleaning and maintaining floors, and reporting leaks as well as spills regularly, and also the storing cylinders upright and storing flammable in approved or the closed containers, and wearing proper personal protective equipment like hearing protection wherever it is necessary, and maintaining electrical equipment according to the manufacturer as well as the company standards, and regularly inspecting tools, cords, grounds and accessories, locking and tagging out the power sources and switches when servicing or repairing mechanical equipment is going on, and learning to recognize and treat the signs of heat stress and drinking plenty of water and not entering restricted radiation areas unless trained and authorized. So these are the most important things one has to remember. And treating and interviewing aggressive patients in relatively open areas and reporting all assaults or the threats to a supervisor or manager. And some other preventive measures are the sometimes what will happen, hospital staff members can be saved from suffering physical hazards during their working hours if suppose some of the things can be considered like prevention of fires, storing cylinders upright, storing flammables in approved closed containers, and also the putting up proper layout of the hospital, particularly evacuation pathways and prevention of slips and falls, and properly cleaning and maintaining floors, and prevention of electrical hazards and maintaining electrical equipment according to the manufacturer as well as company standards, locking and tagging out power sources and switches when servicing or the repairing mechanical equipment is going on. So these are some of the important mitigation measures one has to observe in the hospital sector. And sufficient access and working place should be provided and maintained around all electrical equipment to permit ready and safe operations, and maintenance of such equipment in a regular training and surveillance where employees are trained not to plug or unplug electrical equipment when their hands are wet. And some preventing needle injuries or otherwise we can say that mechanical hazards are not bending, recapping or removing the contaminated needles. This is most important risk in the hospital sector. And also unless such an act is required by a specific procedure, and also it has no feasible alternative, then only these have to be performed. And they have to keep hazardous agents labeled properly and also dispose them in a proper containers, and wearing proper personal protective equipment. And also sometimes if noise is very high, acoustic shields have to be used, and enclosures and barriers should be established around the machines which generate high intensity noise. And also for preventing violences in hospitals, they have to use the security devices like panic buttons or otherwise beepers and surveillance cameras, alarm systems and card key access systems, and security guards in hospitals to prevent the violence against the staff. And controlling access to the working areas for the lay persons, that is treating and interviewing aggressive patients in relatively open areas, what we have already discussed, and establishing liaison with the police authorities, that is also most important factors one has to consider, and contact them whenever there is a necessity, and providing adequate staffing even during night shifts. So increase staffing in areas where assaults by patients are likely, as in emergency department, and regular periodic training to staff regarding the evacuation strategy, and also some protocols during the emergency, and regular drills among the staff is highly required. Dear learner, with these I would like to conclude that healthcare workers have potential exposure to many occupational hazards which put them at risk at different injuries and disorders. To reduce the risk, the threats, the health of this working group, it is important to identify the hazard and define which hazards are predominant and in priority. So training approaches should be developed and appropriate preventive strategies should be considered to reduce the risk as well as to minimize the hazards. With these I would like to conclude, and the next session we will come up with some other important aspects of the environmental and occupational hazards. Thank you.